so many times where someone has said to me, and I've run out and I couldn't afford to refill my prescription, and now they're calling 911. But this one it was a construction site, and the reason we were called was because a guy fell off a ladder right at the top of a roof. It was a 2-story home being built, and when we got there was this poor guy laying in a pile of rubble. His injuries were significant, and he was not conscious at the time when we initially arrived, so he wasn't able to tell us what happened, but he was part of a whole work crew there building a house. So of course, naturally we asked, can someone tell us what happened? We can see the ladder laying over there, and we were kind of putting 2 and 2 together, but we don't like to assume things. And one of the other guys said, yeah, he was right at the top of the ladder, and he had handed me whatever it was, a tool or something, whatever he had gone down to get from the truck. And they were just getting ready to tie him off so he could step onto the roof. And he's like, I turned and I put this thing down on the roof, and I turned back and he was just gone. He said, and I leaned over and I looked over the side and I saw him over there having a seizure. So they called 911. And it was just just his worst luck ever. Had he just fallen straight down the ladder, he would have just landed in the dirt at the bottom of the ladder. But due to the physics of how he was having his seizure, the ladder went sideways and kind of took him with him, so he teetered down the length of the house and landed in this big pile of construction scrap and debris that had just been collecting at the side of the garage. So there was cuts of lumber and scraps of this and that, and there was a big piece of concrete in this pile, and that was what he landed on while he was having his seizure. We did our paramedic thing, and we got him all packaged up, and we got him put in the truck. And as we were driving to the hospital, he was kind of starting to recover from his seizure. And as we were getting closer, he was now in the capacity to tell us, one, lots of things hurt. Like I said, he had really significant injuries. But we were able to start asking some of those standard questions that we ask everyone. Do you have any diagnosed health issues? Are you on any prescribed medications? Are you allergic to anything? Kind of those standard questions. And he identified that he did have a seizure disorder. And when we asked about the medications, he said he'd been off them for quite some time. We always ask why. Because, is it the side effects, these kinds of things, like what's going on? And he just said straight up, I couldn't afford to refill it. I'm waiting to get paid. So, yeah, we got him into the hospital and got him lifted over onto the bed, and then that whole symphony of healthcare that happens with a really significant trauma where there's 12 people in the room and they're all doing something different, and the lead physician, the trauma lead, is issuing all of the work that needs to be done, and is going kind of down through the list and delegating off all of this work. And as she's kind of getting to the end of the list, stops and says, okay, and let's get a gram of Dilantin into this guy, because the last thing we need is him having another seizure. So at the end of the day, healthcare paid for his medication. He just had to fall off a ladder and sustain life-threatening injuries to get it. And when you start calculating the cost of that, of the emergency response, of everything that happens in the emergency department, of the multiple surgeries that this guy was going to have, his recovery in the hospital, his rehabilitation and therapy, and this is all to what outcome, I don't know if he ever went back to his life, what kind of deficits he had from these injuries. These would be the kind that would carry with him for the rest of his life. I suspect we could have just paid for his medication for how many lifetimes over for that one incident, and that is a single example that occurred on one day in one place in Alberta. It doesn't even begin to address the larger conversation. And that one just always stuck in my mind, that it was so stupid that at the end of the day, he got the medication in the hospital. He just had to fall off a roof to get it. It's so dumb. So I think that'll be one of the last memories that I have as I age and start getting fuzzy on details, and that one will hang with me.